Both Vivitrol and Sublocade are medications used in the treatment of opioid use disorder, but they differ in their formulation and administration. Vivitrol is an extended-release injectable form of naltrexone, an opioid receptor blocker. It's given as a monthly intramuscular injection in the buttocks. Naltrexone works by blocking the effects of opioids in the brain and reducing cravings. Also, if a person did use opioids, the naltrexone would block those effects. But one key fact, this blocking effect can be overcome with a high enough dose or potency of opioid. Sublocade is an extended-release injectable form of buprenorphine, a partial opioid receptor activator. This is the same buprenorphine in Suboxone, the sublingual tablet or film. As a lot of us know, buprenorphine stops withdrawal symptoms and cravings by partially activating the opioid receptors in the brain, but it doesn't produce the same euphoria as full agonists or activators like heroin, oxycodone, or fentanyl. Sublocade is typically given subcutaneously, meaning under the skin, usually around the belly button. It's given once a month, just like Vivitrol. How does Vivitrol compare to Sublocade? Let's talk about effectiveness and safety. In terms of effectiveness in treating opioid addiction, studies show that Vivitrol is equally as effective as Suboxone in preventing return to opioid use, aka relapse. So notice I didn't say Sublocade. The issue is there aren't any published studies comparing Sublocade with Vivitrol head-to-head. But there are studies comparing Suboxone, aka sublingual buprenorphine, to Vivitrol. This research showed that Vivitrol is equally as effective as Suboxone if the patient was able to start Vivitrol successfully. In this study, only 72% of people were able to start Vivitrol versus 94% of people starting Suboxone. Because there's a rub. You have to be opioid-free for 7 days before starting Vivitrol. Otherwise, it could precipitate withdrawal. That's 7 days of detox before getting the injection. This is much easier said than done. In order to start Sublocade, you need to be on Suboxone for 7 days first. And getting onto Suboxone does not require a 7-day detox from opioids. Typically, it's 8 to 12 hours of detox, though with fentanyl or methadone, it's a little bit more complicated. In terms of safety, the study looking at Vivitrol versus Suboxone showed that Vivitrol is equally as safe as Suboxone if the patient was able to start Vivitrol successfully. And what I mean by safety is overdoses and deaths. But when comparing patients who intended to start Vivitrol versus Suboxone, there were more overdoses for Vivitrol than Suboxone. So the research suggests that choosing Vivitrol might be less safe than choosing Suboxone. Now, what does that mean for Sublocade, the shot? Again, there are no head-to-head studies, but I think it's fair to suspect that Sublocade will lead to fewer overdoses than Vivitrol. Another point about safety. I personally don't think this is discussed enough. With Vivitrol, there is an increased overdose risk compared to Suboxone. This happens because when you're on Vivitrol, aka naltrexone, you lose your tolerance to opioids rapidly. On buprenorphine, which includes Sublocade, your tolerance changes more gradually. So if someone relapses with lower tolerance, they're more likely to overdose. So to summarize, Vivitrol is probably equally as effective at preventing relapse compared to Sublocade. But I think it's fair to say that it's easier to start Sublocade than Vivitrol. So if you've already detoxed off opioids, both Vivitrol or Sublocade seem to be equally effective. If you're still on opioids, it might make more sense to try Suboxone and Sublocade. Every person's situation is unique, and you have to consider your medical history, your goals, and your preferences. So I'd recommend you discuss this with your healthcare provider to figure out what's best for you or your loved ones. Keep in mind that medical developments may have occurred since we made this video, so I recommend checking with up-to-date sources or your healthcare provider for the latest information.